Hi, I'm Dr. Ang here, Dr. Ang Aitin. My practice is at Thomson Medical Centre, Pediatric Centre. I've been a practicing pediatrician for more than 20 years. My usual practice is outpatient. We look after children from birth till maybe 16 years. My specialty basically is in neonatal intensive care. So I handle babies who are after they delivered. More so if they have been admitted to the intensive care, I'll be there to look after them. Of course, after delivery, they come back to the clinic for vaccination and various illnesses. So I hope I'm in the best position at this point to be able to help you in questions pertaining to vaccination. Are vaccinations mandatory? Can I opt out of it? Vaccinations are important for a child as well as for adults. Basically, vaccination is to protect against diseases. So we give it to the child and we also give it to adults as well. So when we give it to a child or to the adult, it protects the child and adult against diseases, but it also protects against diseases for other people around them. That's what we call by herd immunity. Because if more people are vaccinated, the disease load is less. In Singapore, there are 2 vaccines are compulsory, and they are diphtheria and measles. Other than that, there are the other vaccines that are available, and most parents would want them to be given before they enter school because that is a requirement by the ministry. But I would not say they are actually compulsory. Such vaccines are BCG, tetanus, polio, mumps, rubella, and pertussis. Other optional vaccines are in the market at the moment, namely pneumococcal vaccine. Hi, I would like to take my boys for pneumococcal vaccination. However, I wanted to check if there are any side effects with this vaccine. I heard that some children may get a fever, and I was wondering how to manage these side effects. Pneumococcal vaccine, like all other vaccines, can cause minor side effects. For example, such as fever, swelling injection site, soreness in injection site. But these are acceptable side effects in most vaccines. The doctor will usually give you some fever medicine to bring home that will handle the fever. But if there's any swelling or redness at the injection site, that may last about 2 to 3 days. Just put a bit of cold compress at the site that's affected. Very rarely, 1 or 2 patients may come down with high fever. And if that is so, and you find that you cannot handle the fever, just go back to the doctor and seek for advice. Do the vaccines given in Singapore vary significantly to those given in other countries? I am moving overseas in a few months and I would like to understand what my children requires. Vaccination is quite similar in most countries because they are universal vaccine. Most countries you will be given like diphtheria, tetanus, polio, in fact Haemophilus influenza B, measles, mumps, rubella. This will be given both in Asia and in Western countries like Australia, UK, States. But if you are in Singapore and most of Asia, BCG and hepatitis B are given soon after birth. But if you are in Australia, UK and States, these 2 vaccines are usually not given. So if you are moving from one country to another, do check with your pediatrician, do check with the doctor what is the difference, and they should be able to advise you accordingly. What if my child is sick when immunization is due? When the child is due for vaccine and your baby is not feeling very well, I suggest you see the doctor first. The doctor should be able to assess whether the child is actually fit for the vaccination. If it's just a bit of snuffle, occasional cough, there shouldn't be any problem going ahead with the vaccination. But if the fever is significant, the throat is inflamed, I'm sure the doctor will want to defer it and give the medication to your child first before postponing another date for the vaccination. After my son received vaccination against MMR, he started to develop a few reddish and dry patches on his shoulder, chest, back and armpit. Is this okay? MMR is actually a live vaccine. So when we give live vaccine to a child, they're actually inducing a very weak reaction, a measles reaction in the child. So that is the reason why the child comes down with a rash, which is actually like a measles rash. So they get patches in the body about 5 days to a week after the vaccination. So this is accepted and expected side effect of the vaccine. But not every child will have this manifestation. But if your child does have it, it's actually normal. But if you're not too sure whether this is normal or not, I would suggest you bring the child to see the doctor to confirm. I hope I have answered the questions that you have put forth adequately. And if you have anything which you are still not clear, please check with your doctor or your pediatrician. I'm sure they will be able to help you further.